Department of Health and Human Services, HHS, announces major reorganization and job cuts. RFK SHOCKS. Hey everyone, welcome back to the channel. If you're new here, don't forget to subscribe so you never miss an important update. Today, we have some big news coming out of the U.S. Department of Health and Human Services, or HHS. They've just announced a massive reorganization, and yes, it includes the elimination of 10,000 full-time jobs. This is a major shift for an agency that handles everything from disease control to healthcare access for millions of Americans. So what's going on here? Why are these changes happening, and what will they mean for healthcare in the U.S.? Let's break it down. Okay, so let's start with the basics. The HHS is cutting 10,000 full-time jobs as part of a sweeping reorganization. This includes restructuring and streamlining operations at key agencies within the department, which provides health insurance to 160 million Americans, ensures the safety of medical devices, and responds to disease outbreaks. But this isn't the first round of cuts. Since President Trump took office, about 10,000 HHS employees have already exited through voluntary buyouts or dismissals. The department used to employ around 82,000 people, but after this reorganization, it's clear the HHS is going to look a lot different. So, why are they making these cuts? Well, the goal is to centralize and focus on operational efficiency. The plan is to consolidate the HHS functions, like policy planning, communications, and human resources, so that the department can operate more smoothly and at a lower cost. According to officials, this is also in line with a broader push from President Trump and the Department of Government Efficiency, led by Elon Musk, to downsize the federal workforce and freeze billions of dollars in funding. Now, while the idea is to make the government more efficient, critics argue this could lead to serious problems. From stalled medical research to weakened disease monitoring, these cuts could have a real-world impact on the health of Americans. For example, organizations like the CDC and FDA are set to lose thousands of staff members, meaning there could be a serious strain on efforts to respond to health emergencies, like pandemics and disease outbreaks. So let's take a look at how these cuts will affect some of the key agencies within the HHS. The FDA will lose around 3,500 jobs, though safety inspectors will remain intact. The CDC, responsible for controlling infectious diseases, will be cutting 2,400 jobs as it focuses on its core mission, epidemic response. The National Institutes of Health, NIH, which funds medical research, will lose 1,200 employees. The Centers for Medicare and Medicaid Services, CMS, will cut about 300 jobs. All of these cuts are expected to save taxpayers a hefty $1.8 billion a year. But the real question is, will these savings be worth the potential disruptions? In addition to cutting jobs, the HHS is also shrinking its structure. They're going from 28 divisions down to 15, and the department's 10 regional offices will be cut to 5. It's all about trimming the bureaucracy, but this also means fewer boots on the ground for local and regional health responses. One of the major changes is the creation of a new agency called the Administration for a Healthy America, HA. This new agency will consolidate the HHS work in areas like primary care, maternal health, environmental health, and more. It's all part of the vision to focus on holistic health, but with fewer resources to go around. Now, for those of you relying on Medicare, Medicaid, or other HHS programs, you might be wondering, will this affect your services? The good news is that Medicare and Medicaid services are not expected to be impacted by the cuts. And the HHS has stated that no additional cuts are currently planned. But if you work in public health or at one of these agencies, you may already be feeling the impact. These changes will likely lead to more stress on remaining staff, potentially impacting everything from disease response to healthcare research. So, there you have it. A major overhaul of the U.S. Department of Health and Human Services, with 10,000 job cuts, agency consolidations, and a massive reshaping of its structure. Will this lead to greater efficiency and lower costs? Or will it cause more harm to the healthcare system and leave millions of Americans at risk? Only time will tell. Let me know your thoughts in the comments below. How do you think these changes will affect healthcare in the US? And if you enjoyed this update, don't forget to give the video a thumbs up and subscribe for more news on this developing story. Thanks for watching, and I'll see you in the next video.